This is what a normal heart scan looks like. A specialized X-ray gives doctors all kinds of views of a heart, and the diagnosis is up to them.
The cardiologists, on average, get it right about 80% of the time. Some people do very well, they do better than that. Some people do less than better than that. The same person who does very well one day may not do quite so well the next day. And I think what we can achieve with this system is we can standardize and get it accurate every time rather than relying on that day-to-day variability.
So these two English doctors are training an artificial intelligence algorithm to do it better. As with all computer programs, the more data it has to study, the better it will be.
We set about trying to extract as many different measurements, and what we thought would be sort of 10 to 20 measurements, which is currently what the clinician looks at for in the image, turned into 80,000 measurements. So we're able to extract so many more measurements than we ever thought possible, really.
To the doctors who are testing this software, it's deadly serious business.
The consequences of getting the diagnosis wrong is that you either send the patient through to an invasive surgical procedure that they don't need, or, which is even worse, you send the patients home with coronary artery disease, and those patients you send home will have a heart attack out of hospital when they should have gone through and had surgery right there and then.
As with all applications of artificial intelligence, these doctors are also seeing uses for the program in all kinds of other medical fields.
There's lots of other different diseases such as valve disease, heart muscle disease, high blood pressure. All of those things affect your heart. We plan to tackle those as our next sort of questions and our next products. So we hope to be able to help patients in those different disease areas there.
Researchers plan to make the system, called Ultronics, available to Britain's National Health Services later this year. Kevin Enochs, VOA News.
But Ultronics, taking as many measurements as it does, we're able to pick up these segments.